Welcome to the What Matters presentation, where we will discuss the importance of communication. Communicating effectively is an essential part of understanding what matters most to older adults. It's helpful to understand and address common barriers for effective communication to reach the goal of delivering age-friendly care. As we have said before, daily caregivers make a big difference in the quality of life and living of older people in their care by using the age-friendly framework. There are many opportunities to talk with older adults as you provide assistance with daily cares. Talking about the person, their lives, interests, and care preferences can help you learn what matters to them, and in turn, you can help the person do what is enjoyable or important. When daily caregivers focus on quality of life for residents, they greatly increase the chances of improving their own quality of work life. In so many different ways, what is good for the resident is also good for daily caregivers. In order to understand what matters to older adults, caregivers need to be able to communicate effectively with the older person. Anything that interferes with that process is going to affect the quality of the information that is gained, and in turn, decisions about how to respond and care for the person. Let's review some of the things that might interfere with the older person understanding the caregiver, and also what interferes with caregivers understanding the older person. One set of problems is the result of mental and physical health problems that tend to cluster in later life. When we are trying to interact and connect with the older person, we need to think about all the possible ways that health-related problems might interfere. Although, many different health problems can interfere with communication, such as dementia or stroke, or even changes in vision and hearing. There are lots of things to consider, so slow down and think about the person and the situation. Another set of issues related to healthcare is being task-oriented, meaning that caregivers interact with the older person around an activity like getting dressed or bathing, eating, walking, taking medication, or some other chore. Caregivers may lapse into thinking about communication as just a way to get the job done. Little attention is paid to talking about what matters to the person, although this is a perfect time to learn about their long life and current preferences. The environment of many care settings can interfere with having meaningful conversations. As you ask about what matters to the person, consider how noisy it might be and if they can hear you, or if there are simply too many other things going on around you that either are distracting or feel like an invasion of privacy. As in the task-oriented work that many direct caregivers do, it is easy to forget that communication serves many social and emotional needs as well, and that those may be more important to the older person than the task at hand. Older people in care also need reassurance, encouragement, concern and understanding, and interest in them as a human being who have many interests and concerns other than their health conditions. Simple changes can make a big difference. Most important, caregivers can let the older person know that you care about them, that you are interested in them and willing to talk and listen. You can tell them you care through your tone of voice, your facial expressions, your gestures, and your words. Remember, nonverbal communication is just as powerful or maybe even more powerful than the words you use. Looking or sounding angry or frustrated sends a message that you may not intend, one that shuts down talking about what matters to the person. Caregivers can also adjust how they talk with residents to improve understanding on both sides. Using simple but clear language and short sentences also helps. Try to slow down, pause, and watch the person to see if they seem to understand you or the question. Listen carefully to both what they say and watch what their body language might be saying. Remember the value of sensitive listening. Listening until the person has finished talking. That means listening without interrupting, cutting the person off, disagreeing, correcting or tuning out what is being said, but instead listening for meaning. What matters most? Today, tomorrow, and how can you help? Remember that the resident may need more time to consider a question and provide an answer. Adjust the pace of your interactions accordingly. Slow down and give the person a chance to think about what has been said and then respond. Also, be sure to use language that is familiar and understandable to the person. Too many health providers slip into using medical jargon that is not understood by the average person. For example, the word urination or even peeing may be more understandable than voiding. Likewise, using slang terms that are unfamiliar or uncomfortable to the person may also interfere with good quality interaction. And to the extent possible, be clear and concise. Long, wordy, or vague language often interferes with good quality communication. When making simple changes to our communication style with older adults, it is important to focus on what matters to the person. We can't assume that we know someone's preferences, even if we've known the person for quite a while. It is especially important not to make your best guess for a resident, even if the resident has trouble communicating choices. Think about offering choices that fit the resident's preferences. It can make a big difference in someone's day to make personal choices. You can ask if they prefer to shower before or after lunch, or you can show them clothing options for the day and ask if they prefer to wear the red shirt or the blue shirt. You can ask permission to assist the resident with participating in desired activities. This is particularly important if a recent illness or injury has changed the person's ability to join in activities that were previously enjoyed. Offering assistance for residents to take part in favorite groups and pastimes shows your interest in their health and happiness. Most importantly, when you take time to communicate and learn what matters most to a resident, don't keep it to yourself. Share care preferences and even successful communication styles with the rest of the care team. In summary, your conversations about what matters in daily care and activities can make a big difference in quality of life for residents, but also in the quality of your work life. Understanding what matters relies on your ongoing conversations with residents to best assure changing priorities are understood and daily care routines and activities are adjusted. Remember to pay attention to both spoken words and nonverbal communication. And sometimes it is just as important to pay attention to your own communication style and patterns as it is to pay attention to what and how the resident is communicating. Listen carefully for meaning and never hesitate to adjust your approach and routine to fit what matters most to the person. Next, I hope you listen to the What Matters podcast to hear about how age-friendly care positively affects residents, caregivers, and even nursing professionals.